When I think of spinal deformity, scoliosis comes to mind. I think most people would agree that when someone has a crooked spine, that is somewhat noticeable. I think when we get older, the incidence of spinal deformity is more common. In evaluating patients who may have a spinal deformity and who may have effects from that, we look at several things. We do a thorough examination, take a thorough history, try to determine if they are having issues with balance, with their activities of daily living, if they're having difficulty just maintaining on a daily basis the amount of pain. We evaluate their stance, their gait, and all of that's done in the office. Then we do sophisticated x-rays and MRI scans to try to better define what the issue is. The things that I would tell you as a patient or someone who may potentially have a spinal deformity is that if you have difficulty walking from one place to another and that's getting worse, if you have difficulty looking up or your gaze tends to be more down at the ground, and then some of the obvious things when it gets to be rather remarkable that patients may have a rib hump, they may have one shoulder higher than the other, and those are the things that you really look for when you're trying to evaluate someone with a spinal deformity. I think the issues that we oftentimes find in patients, especially the elderly, they didn't realize they had it, but it actually has been affecting them for quite some time.